Welcome to the IV Cannulation and Phlebotomy Assessors workshop. This workshop has been carefully designed to prepare you for the critical role of assessing and supervising IV cannulation and phlebotomy practices. As an assessor, you play a pivotal part in maintaining high standards of care, ensuring nurses under your guidance develop the skills and confidence to perform these procedures safely and effectively. Throughout this workshop, you'll gain practical tools and knowledge, covering everything from district policies and ANTT principles to providing constructive feedback and troubleshooting common challenges. Our goal is to empower you to assess confidently, provide meaningful feedback, and ultimately contribute to improving patient outcomes. In this workshop, we'll cover several essential topics to help you excel as an IV cannulation and phlebotomy assessor. We'll outline your role as an assessor, focusing on providing guidance while staying objective and professional. You'll understand why accurate documentation is vital for accountability and ensuring safe, consistent practices. The SBI framework is a structured approach that will equip you with the tools to provide clear, actionable, and constructive feedback during competency assessments. We will review evidence-based techniques and district policies that maintain high standards of care. By the end of this workshop, you'll have the tools and confidence to assess and support nurses effectively, ensuring safe, competent, and high-quality practice. Let's take a look at the key performance outcomes for this workshop. By the end of this training, you'll be able to supervise and evaluate nurses as they perform IV cannulation and phlebotomy, ensuring safe and effective practices. Provide clear, constructive feedback to help nurses refine their techniques and build confidence. Ensure that nurses adhere to the district guidelines and ANTT principles, maintaining consistency and patient safety. Identify errors or unsafe practices during procedures and offer immediate corrective guidance to address these issues. Finally, support nurses in developing safe, accurate, and confident IV skills while upholding the highest standards of patient care. As an assessor, your primary role is to ensure that the nurses under your guidance achieve the required competency in IV cannulation and phlebotomy. This involves observing, guiding, and evaluating their practice based on evidence-based principles and district policies. These key responsibilities include overseeing the nurse during competency assessments to ensure procedures are performed safely, accurately, and in line with the guidelines. Assessing the nurse's ability to follow procedural standards, including aseptic non-touch technique, proper vein selection, patient safety measures, and documentation accuracy. Providing constructive and actionable feedback that highlights strengths and identifies areas for improvement. It is critical for assessors to maintain clear boundaries to ensure the integrity and objectivity of the competency assessment process. The assessment must be unbiased, focusing solely on the nurse's performance and adherence to guidelines. Personal relationships or external factors should not influence the evaluation. While it is important to guide and support the nurse, assessors must refrain from completing procedures or making allowances that compromise the assessment process unless it's necessary to do so. Avoid overstepping into roles such as mentoring or teaching during the formal competency assessment. While guidance is acceptable, the primary focus should be on evaluating and ensuring competency. Proper documentation is essential in recording and validating the competency assessment process. This ensures transparency, accountability, and clear record of nurses' performance. Use structured assessment tools to evaluate performance against predefined standards, such as vein selection, technique adherence, and patient safety. Document factual observations, such as whether the nurse followed the correct order of blood draw or adhered to ANTT principles. Avoid subjective or opinion-based language. Completing the official competency sign-off only when the nurse has demonstrated full adherence to the required standards. Documentation has significant implications for both the assessor and the organization. A signed-off assessment acts as a formal evidence that the nurse is qualified to perform IV cannulation and phlebotomy independently. As an assessor, you are professionally accountable for the accuracy and integrity of your assessments. Inaccurate or incomplete documentation can lead to legal and professional repercussions. Proper documentation protects both the nurse and the organization in case of patient safety incidents. It serves as proof that competency was thoroughly evaluated and met organizational standards. As an assessor, your actions have direct consequences on patient safety and care quality. By ensuring that only competent nurses are signed off, you play a vital role in upholding the highest standards of practice within our organization. To ensure effective documentation, use the competency assessment checklists, record detailed observations and outcomes for each assessed procedure, and include constructive feedback within documentation for reference during subsequent evaluations. The Situation Behavior Impact, or SBI framework, is a structured and evidence-based approach to providing feedback in clinical settings. This framework helps assessors deliver clear, objective, and constructive feedback that focuses on observed behaviors rather than personal attributes. By separating facts from opinions and focusing on outcomes, the SBI framework encourages professional growth and fosters a supportive learning environment. Begin by describing the specific situation where the behavior occurred. Provide clear context, including the time, place, and task being performed. This step grounds the feedback in a specific moment, avoiding generalizations that could lead to defensiveness or confusion. Objectively describe the behavior that you observed, focusing on actions rather than interpretations or assumptions. Avoid subjective language or judgments like, "You were careless," and instead use factual descriptions like, "You did not stabilize the vein before inserting the cannula." Explain the effect of the behavior on the procedure, patient safety, or team dynamics. Highlight the importance of the correct action, emphasizing patient outcomes or procedural accuracy. Avoid vague or generalized statements like, "You did that wrong." Instead, focus on what can be improved, like, "The cannula angle was too steep, leading to vein trauma." Provide examples of alternatives to guide improvement. Emphasize actions and outcomes rather than attributing the issues to personal traits. For example, instead of saying, "You're not careful," say, "I observed that the vein was not anchored before insertion, which could cause the cannula to miss the target vein." Ask open-ended questions to involve the nurse in feedback process, such as, "What do you think went well during the procedure?" And "What might you do differently next time?" Balance feedback by acknowledging areas of strength or improvement. This boosts confidence and ensures the nurse feels supported. For example, "You did an excellent job identifying an appropriate vein for this patient with fragile access. Next time, remember to allow the skin prep to dry fully to reduce infection risk." Provide feedback as soon as possible after the behavior is observed, while the situation is still fresh and relevant. Offer practical advice or steps the nurse can take to improve their practice. For example, when preparing the site for IV insertion, ensure the antiseptic solution dries completely. You can count to 30 seconds before proceeding.